Hi, it's Dr. Ovalle with Avana Plastic Surgery. I'm a board-certified plastic surgeon. Today we're going to be talking about breast augmentation. There's a lot of important things to know about breast augmentation. It's a surgery that helps patients get more volume, contour, and fullness of the breast. It can be done at any age in adulthood. That it's important to know some facts about how we do it. The first thing is saline versus silicone implants. Those are the two choices. Saline implants and silicone implants both have silicone in them. An implant is made up of the shell, which is the covering, and then the filling, which is the inside of the implant. A saline implant has a silicone shell, but it comes empty, and inside of the body, after we place it, we fill it with saline, which is salt water. That silicone implant has a silicone shell and has a silicone gel filling. There's different types of silicone gels that are different by the number of cross-links of the silicone molecules in the gel, so some of them are a little bit softer and some of them are a little bit firmer. That the most common implants that we use are smooth and round, and that there's different places that we can put the implants. We can put the implants above the muscle or underneath the muscle. For most women, going underneath the muscle it is the most common way to do it, and that's because the muscle is a very good healthy layer of tissue that covers and protects the implant, and there's a lower risk of something called capsular contraction, which I'll talk about in a minute. That in very thin women, it's also probably preferable to put it underneath the muscle because the muscle can help smooth out the edges of the implant, and if somebody is very, very thin, then they may be a little bit more likely to see the edges of the implant if you put it above the muscle. Putting it above the muscle, the recovery is a little bit faster because it's a little less discomfort to not lift up the muscle versus when you do. However, after the first few days or first week or so, that both techniques of implantation, the recovery is about the same. That there are some women that if you put the implant underneath the muscle, you may see it moving a little bit with a lot of pec movement, and that's a little bit more obvious in women who may be bodybuilders or weightlifters, just because of the nature of the exercises that they're doing, and that's something that's called animation. The important things to know about the implant are also the incision, where we place the implant through. The most common incision is called the inframammary fold, or the IMF incision, which is a small incision of about 1 inch to 1.5 inches underneath the breast fold. That hides very well in the crease, and that it gives us very easy direct access to make the implant pocket perfectly for the patient's anatomy. There's another way to place implants around the areola, which is nice because the incision hides at the border of the pigment and the non-pigmented skin. However, this incision may have a little bit higher chance of the capsular contraction that I mentioned earlier, and that we'll talk about in another minute. Another important thing to know is if we need to do a lift at the same time as the breast augmentation, because the implant, again, will give more volume and fullness, but it won't change the position of the nipple and the areola in relationship to the rest of the breast. That if the nipple and the areola is lower than the fold of the breast, that is kind of the classic rule of thumb where we should consider doing a lift, because we want the nipple and the areola centered on the breast mount to make the most aesthetically pleasing breast. And it depends on how far down the nipple is compared to the breast fold, because there's different techniques to achieve the breast lift. There's a peri-areolar breast lift, which goes just around the areola. There's a vertical breast lift, which goes around the areola and down to the bottom of the breast. breast. And then the full mastopexy, which is called the Y's or the anchor pattern, goes around, down, and across the bottom. And those techniques all give you varying degrees of lift, with the periareolar being best for very small degrees of lift, and the full mastopexy Y's pattern lift being the most powerful to lift the nipple up the most amount of distances and remove extra skin. The important things to know about implants are that they're not technically meant for life, although some women do have them their entire lives without having any issues. The age of the implant is the number one predictive factor for if a patient may need another surgery down the road to revise or replace the implants. Usually patients that I see, I counsel them that they shouldn't really have a high chance of any issues in the first 10 years, and that between 10 and 20 years, it's a good idea to be seen by a plastic surgeon every 1 to 2 years, just for an exam and potentially for an ultrasound or an MRI to look to make sure that everything's okay with the implant. And then after 20 years, that we consider that old implants. And if a patient's not having any issues, again, they don't have to have them removed, but it's worth a conversation to see if just a prophylactic implant exchange or replacing the implant when it's that age may be of use to some patients. That the other important things to know about implants are that there's a very small chance of rupture, that is low single-digit %, that if you have a rupture in a saline implant, that you're going to know because it's filled with water, so the water is going to slowly leak out and it will slowly deflate. A rupture in a silicone implant, on the other hand, is a little bit tougher because you may not notice any change, that it would take an ultrasound or an MRI to see that small rupture. The latest silicone implants are very cohesive. They're called the gummy bear implants, and that's just because just like the inside of a gummy bear, that if there's a cut in a gummy bear, the gel or the filling of the gummy bear doesn't spill. And same idea in the implant, all the links between the silicone molecules keep that gel all together. That besides the risk of rupture, there's a risk of something called capsular contraction, which is very important to know about. That anytime that we place an implant in a patient, that what's supposed to happen is the body forms a very small, thin scar tissue layer around the implant. It's called the capsule. That's normal. That usually patients don't know or feel that it's there, and that's how we want it to stay. That in some cases, either due to genetics or some inflammatory or infectious event, or perhaps a rupture, that the body starts to make a little bit too much scar tissue, and in some cases it can even start to contract or squeeze around the implant, and that's called capsular contraction. Patients may see one implant start to look maybe higher or different than the other side, and then in some cases it can cause some discomfort from the tightness. The cure for that is to remove the scar tissue around the implant, which is called a capsulectomy, and also replace the implant or do an implant exchange. Hopefully you learned something about implants, and that may be a lot of details for some patients, but it's all important information to cover. Really appreciate you guys for tuning in. Again, it's been Dr. Ovalle, board certified plastic surgeon with Avana Plastic Surgery.